Hello everyone, compliments of the season. Now, as your eye doctor, there are certain things that would wish that you patients know about your eyes or know before coming to the clinic. One of which is that there's a difference between the basic test and the comprehensive test. The basic test just gives us a basic status of your vision, your ability to see at far and your ability to read. It's not really detailed, it's not really thorough. But when you come in for the comprehensive test, that is actually more thorough and elaborate. There we take the time to properly examine you, and if you have any form of disease condition of the eyes, okay, such as, let me say, hypertensive retinopathy or diabetic retinopathy or glaucoma or cataract, etc., will actually let you know. Something else I would like you to know is that when coming to the clinic, we expect you to bring along your medical history. You tell us everything about yourself, your medical status. If you are currently on drugs, you let us know. If you are allergic to drugs or certain drugs, you let us know. If you have certain health conditions that kind of like makes it difficult for you to take certain drugs, you also let us know. Also, your family history, we would like to know too, as much as possible. Again, if you have contact lenses, contact lens solution, if you have previous glasses you have used, or a prescription of a previous glass, you bring it along. We would like to see all of that. One other thing we would like to do is we would like you to know that glasses don't actually spoil the eye or damage the eye. Some patients have this misconception that after using glasses for a while, the eyes get worse, or they get addicted to the glasses, or they have to keep using the glasses all the time in order for them to see. Well, that is not actually the case. The point is that glasses tend to correct any form of refractive error that you have or blur vision. So there are instances where certain degrees of refractive errors tend to disappear with time, in the sense that by the time you use the glasses for a period of months, the refractive error corrects itself. There are also instances where you just have to use the glasses for the rest of your life. That is a fact. So it is not it's a situation whereby different strokes apply for different folks. So I would really like to clear the air on that. Another thing we would like you to know is that there are certain daily habits we expect you to start carrying out that will help to strengthen the eye. One of which is that you should, with the advent of electronic devices, your laptop, your desktop, your iPad, and all the rest, with the advent of these devices, people are having less blink rate. Blink rate among the populace has really reduced. So it is really affecting a lot of patients, in the sense that we're now seeing so many cases of dry eyes, so many cases of itching, so many cases of electronic induced redness, strain, a lot of cases of strain. So we would like you to, on your own, apply this rule, which is that after looking at your phone or device for 20 minutes, you try and look away from your device for 20 seconds, okay? At least 20 feet away. If you can look up to 20 feet away or 6 meters away from you for 20 seconds, that will go a long way to restoring the tear layer of your eye and ensure that the eye is the blink rate is restored. Another thing I would like you to understand is that in this part of the world, the UV rays from the sun is quite intense during midday. So we would like you to try and protect your eyes. Okay, so you can buy your sunglasses. Sunglasses are very, very advisable at this point in time, especially in this dry season that we are in right now. So if you can get your sunglasses, you wear your sunglasses, the bigger the better. If you can find a sun, not all sunglasses have UV protection, so you must be particular about the UV glasses you're buying. Make sure it has UV 400 and above SP protection. It goes a long way. UV protection, it goes a long way to protecting the eye from the harmful rays of the sun that bring about early degenerative conditions of the eyes. Again, we also like you to know that for those of us that, or for those of you that use contact lenses, we would like you to know that contact lenses and water don't parley. Okay, they don't go hand in hand. If your contact lens comes in contact with water, definitely that contact lens is damaged. Okay, so we would advise that you try not to bring your contact lens in close proximity with water or water touching it. So as much as possible, try to use your normal contact lens solution provided to you by your eye doctor. This helps the contact lens stay fresh and stay as long as possible. Again, some patients have this attitude of wanting to sleep in their contact lenses. Sometimes they forget, sometimes they do it deliberately. So we would advise that as a patient, you try and reduce the rate at which you sleep in your contact lens. Most of them, even though these contact lenses now are so advanced in technology that you can actually sleep in them, there are certain brands that are that good in the sense that you can sleep with them for days, but clinically we would advise against that. Okay, if you do it once, do it twice, that is fine, but not making it a habit. So try and reduce the rate at which you sleep in it. Another thing we would like you to know as a patient is that nutrition is very, very good, you see, for the eyes, especially with the high rate of processed meal or processed food we have these days in the market or in the society. So we would advise that you try and take a lot of carrots. Carrots are high in beta carotenes and they are very good for the eyes. So you try and buy as much of it as possible and eat. Again, we also advise that you buy as much as possible these green vegetables, the green leafy one. If you can find anyone in the market, that is fine. For those of us who live in other climates, I know that the spinach is quite common. Okay, so if you can find spinach, if you can find kale, you buy as much of it as possible and eat. For those of us in this part of the world, there is the green ogo vegetable which we use mostly in making soup. It is quite healthy. So that is it for some of the things we would like you to know. Another thing again we would like you to know when coming to the clinic is that after examining you, the doctors would like to know certain things about, who expect that you ask us certain questions, such as what does the result or what does the outcome of the test mean for your eyes. You see, this shows us that you are really interested in knowing your status. Some patients just want to have the test and leave. Okay, they don't really ask questions, and many of them don't really know their health conditions, so which is not a very good thing. You see, so in the same way we know our blood group and genotype, so we also need to know our refractive status, especially for those of us who use glasses. So it's very important that you ask your eye doctor going forward, how is this glasses, how is my eye going to evolve? Do I expect it to get better? Do I expect it to get worse? Or is it going to remain the same? You understand? So it is a very welcoming question. We would really like to answer that. Again, another thing we would like you to ask us is that going forward as patients, you understand, what is going to be the state of my eyes? Are my eyes going to evolve to get better, or are they going to evolve to get worse? So in the coming years, okay, because as we get older, there are certain conditions, there are certain refractive conditions that emanate depending on our lifestyle, again depending on our age. So we would really like you to ask us how your eye is going to evolve as you get older. And the last but not the least, we would like you to ask us if, with the preponderance of electronic devices, we would like you to ask us if going forward, if the electronic devices, how they are going to impact your eyes, and what you as a patient can do to actually limit your exposure to blue light. Okay, and apart from blue light, what we can do to make the eyes healthier, because almost 80% of the population these days, everybody has either a smartphone or a tablet or a laptop. So all of these continuous use of it is actually impacting the eyes negatively. So we would like you to ask us, how do we improve on our eye health? How do we improve on our vision going forward with all these electronic devices that we're using? So these are many more, okay, we would like you to ask us. Okay, so this is where I end this conversation for today. So going forward, we would like you to follow, like, and share, and for more updates. Bye.